Hey everybody, this is Kevin McFarland from The Art of Emergency Nursing, and you're listening to 30 Days to Being a Badass ER Nurse. In the next 30 days, I'm going to give you some quick tips and tricks to help you be a better ER nurse. And of course, as always, it's not just me you're going to hear from. I've recruited some of my friends to give you some of their tips and tricks so they can share their knowledge as well. So don't forget to subscribe so that you catch all the episodes. And if you find one of these tips and tricks are really helpful, give me a shout out on social media and share it with your friends. Let's get into today's tip. Welcome to day 20 of the 30-day podcast, 30 Days to Being a Badass ER Nurse. This tip was called in from a brilliant young nurse from California named Janelle. Take it away, Janelle.
Hi, Kevin. This is Janelle from California. I just wanted to drop in my 2 cents about the best tip I've gotten as an ER nurse. An older nurse said to me when I started out that you never stop learning in this job, and when you think you've known it all, it's time to quit. I definitely took that to heart, and I think that's one of the most important parts about nursing, and one of the things that drew me to emergency nursing was that there is always something new to learn, and it's always evolving, and so you have that. It sort of feeds that part of my soul that just wants to know and learn and have things change all the time. That way you don't get bored, right? And I would just add to that, always ask the question, if you have an order that you don't understand, or the doctor maybe ordered a medication that you think isn't correct for your patient, you're either going to learn something because maybe it's a new off-label use, or you're going to catch a mistake. So don't be afraid to ask the question and just keep your mind open and keep learning. I think that's the best thing I can say. Thanks a lot.
2 things as a nurse I feel like you owe your patients. One of them is you owe your patients to always advocate for them. So if you question an order, if you're not sure what the order is, definitely make sure you ask. If you're not sure why, like Janelle said, you will learn something. And that something may be something worth learning. If nothing else, it'll help clarify your understanding. This is especially important if you work in a teaching environment. And when you work in a teaching environment, you know that the nurses, you know that the residents may not have much more information than you do. So you got to protect your patient all the time by advocating for them. The second thing I think you owe all your patients is to commit to being a lifelong learner. Being a lifelong learner is absolutely critical in emergency nursing. My friend Nisa posted something on social media today that really resonated with me. It was a new nurse tip, and it said, "Science and medicine change so fast. Get ready to learn, unlearn, and relearn." And I think that's absolutely critical for nurses today. Well, I hope these tips help make you a badass ER nurse. I hope you have a great day and have a good shift.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.